Okay, Health Hero series. Today we have Jo Medhurst from Jo Medhurst Therapies. Hi Jo, how are you doing?
Hi, I'm good, thank you. How are you?
Very well. As you can see, this is not when people are seeing this, it's the new year, but I forgot to change. So
Just
we're recording this in
Christmas
December and I've
magic.
still got my Christmas jumper on. I was meant to do a quick switcheroo before coming online and I've just realized that.
That's
So anyway, I'm Kate Cherry. I run the Athena Network, which is how I know Jo because she's in my Bedford group. But also, I have a business with skincare and nutrition brand Arbonne. We're a big B corporation, and we pride ourselves in providing, helping people to reduce the chemical overload or toxic burden from the products they put onto and into their bodies day to day. Which is why when I meet someone like Jo, it's like, oh, synergy. And we all sing from the same song sheet. In
Absolutely.
another if you know anyone with diverticulitis, we had a very long conversation about this when we had
We
a chat on the
did, we
phone, didn't we?
did. Yeah.
Ask Jo about that because, I mean, she firstly explained it to me incredibly well, and secondly mentioned how she'd been able to help someone. So, without
Yeah,
further
there's
ado and
loads we
ruining
can
it
do
all,
for that. If you know how to tackle it, there's lots you can do, which is nice.
instead of those band-aids that you get from doctors, which Jo knows is something that sort of really winds me up. Now, I know so many people in nutrition and alternative therapies, and massage isn't an alternative therapy, it's just a
Mm.
therapy. Um, that there's so much more help out there than what doctors may say or send you off
Yeah.
with or
I
whatever,
think their
and then
specialist
dietitians.
is
So
their specialism's diagnosis for a lot of things, figuring out what's wrong, making sure it's not life-threatening, and then after that, they've not got as much help
yeah,
available for certainly for things that are chronic and stuff. And if that's the area your problem's in, like diverticulitis, you need to go elsewhere to look for some help
exactly.
and
You're
options and
filtered
treatment.
out, your arm's not falling off and you're not having a heart attack. Off you go kind of thing.
But
I know
yeah,
I'm massively simplifying for any doctors or nurses watching. I 100% appreciate everything our doctors and nurses do.
well, I think the
But
resources are limited, aren't they? There's only so much they can
yeah,
do, so
exactly.
it's
Is is that
up to you to look after your health, really.
exactly. Is that a
Mm.
huge issue or is it not a huge issue? So, without further ado, Jo, tell us about your business. What is it you do for people? So, scar and abdominal massage. Tell us
Yeah,
about
so
that.
I'm expanding a bit loosely. So a specialist massage would be a good umbrella term for what I do. So with the abdominal massage, I do a lot of work with people for digestive issues, so things like IBS, bloating, constipation, diverticulitis, as you mentioned. For the scar massage, it's just recovering from these scar issues. So C-sections I do a lot with, post-op cancer work. I've got a few people with skin grafts and things like that at the moment. So just a wide range of things, anything that's giving people problems. Very commonly as well as see things like C-sections, people getting back problems. Sometimes they don't even necessarily know that's the issue and work on people
Mm.
sometimes 15, 20, 30 years even after they've had the C-section. And it's amazing how much doing the scar release work can help with the back problems. So it's looking for that cause of the issue as well as in kind of the obvious things like the scars itching or sore or pulling or whatever. Sometimes there's secondary problems the massage can help with. And then now I do MLD as well, which is manual lymphatic drainage, really good for swelling. That ties in nicely with the scar work because it's really good post-op. Often people get a lot of swelling post-op as everything's healing and recovering. And now I also do clear mind massage, which is one I have invented myself, having done years and years of specialist massage. I now do clear mind massage, which is putting together loads of the other different techniques I use to help people with headaches and migraines. I suffered a lot with migraines myself. I did a lot of work. Luckily, I don't have those anymore. I still get the odd headache for stress and things like that, but I'd managed to sort of downgrade it to the odd headache as opposed to regular migraines, which was causing me really debilitating issues. So it's nice to be able to kind of put that into a massage that can really help people. And that's really new, but I'm having really good results with people. I had one of my first few clients would say this is something I've really developed recently. One of my first few clients came in for a second session yesterday with that and has gone a month with no problems, which she
Mm.
said was just unheard of. And that's great for, for one treatment following the advice. She's got a month and no issues. It's fantastic news. So it's really nice to see really good results with that already, which is great.
That's brilliant because then people who haven't had a migraine um don't appreciate what a migraine is, I believe. So I've had migraines, and I know the other part of your work is nutrition based, and so
Yeah.
you look, that's the holistic side of things. You don't just treat outside, you're treating inside as well,
Yeah,
because
that's
there's
it. So
such a
that's when
link.
we do the headache massage work. It also, I give them all the information to help with things like that. You need to reduce your inflammation, plenty of magnesium, things like that. So I'm nutrition trained as well. I don't tend to offer the nutrition work as like separate things. It's to support
Mm.
all that other stuff that we're doing. So if you're working with people with things like headaches or IBS, or I do a lot of gynae work with the abdominal massage as well. So if you're working with people with gynae problems, balancing hormones is really important too. And if you're missing those sections with nutrition, you can be missing a cause of a problem and limiting the, benefits that you get from a treatment. So it's nice to be able to offer that whole like holistic thing and just make sure we're not missing anything that could be part of the main issue. So yeah, just kind of working in that way to give all that support is really useful for people. And then the idea as well is everyone's got a better understanding of how their body works, and you end up with a bit of a package basically of like toolkit of different things you can use to help symptoms and problems like long term, so you can stop them coming back, which is nice.
And do you see there being a shift in, I wouldn't say the medical professional, but even general public's understanding of well-being and prevention?
Yeah, I think the more time goes on, the more people, like, and with the internet and things like that, influences, a lot of people be following people with various things. Somebody was following someone recently. They were talking about like a scar massage machine that an influencer was in. And like, oh, there's other things out there. So I think gradually it sort of comes into people's understanding a little bit more. And I think also with healthcare limitations, people go and look at other things and what's available. I would always recommend, if somebody comes in to see me, if they're having a consistent problem or pain regularly, I would always say, go to a doctor, go get it checked out. But I very rarely need to say that, because most of the time when people come and see me, they've already done that. So they've gone through that process and they're still struggling. Because as we said before, the doctor said they're able to diagnose most of the time, or certainly rule out any sort of life-threatening serious problems. And after that, the treatment options can, if it's not life-threatening, treatment options can be a bit limited, because that's understandably where they focus their resources. So, and
Yeah.
I think the more people kind of look into these alternatives and have really good results, the word spreads. And certainly now there's more, things like influencers and social media and people sort of following things a bit more, the word can spread a bit quicker sometimes. So yeah, I think sometimes that does help in terms of shift and that positive change and people having more health knowledge and things like that.
It's amazing. I love it. I've just become totally absorbed in it in the last 10 years. And we obviously, this is coming out in the new year. So what's your biggest tip for the new year for people?
So big one, sugar reset is always good. We tend to always eat a bit too much. I absolutely include myself in this. I regularly have to do a sugar reset in January. We often eat a bit too much sugar over the Christmas period, and that leaves you with blood sugar imbalance. Basically, when you're having too much of the simple sugars, it affects your blood sugar more quickly. Your blood sugar's going up and down, and your chromium goes down. So a lot of people are not aware of this. Chromium is a mineral that your body uses to balance your blood sugar. There's other ones like potassium plays a role and things like that. But
Mm.
chromium's the main one. And if you're having a lot of sugar, your chromium goes down very fast, because it's trying so hard to balance that up and down with the blood sugar, and then you're going through it very quickly. And if your blood sugar's out of balance, your chromium is low, you'll get sugar cravings. So if you're finding you're getting sugar cravings, particularly after you've eaten, afternoon, things like that, your blood sugar is out of balance and your chromium's too low. The easiest way to fix this is taking chromium. So a nice natural chromium supplement. It's particularly important to have like the natural food source supplements if you're
Mm.
having minerals, particularly metal minerals like chromium, magnesium, iron,
Yeah.
because they're harder to absorb otherwise. And normally 2 or 3 weeks of chromium gets the levels back up to where they need to be. You stop having the sugar cravings, and then it's much easier to continue to eat more healthily. If you're getting cravings all the time for sugar, it's quite tricky to kind of keep a hold on it. And if you're not having the cravings, that's much simpler. And normally it only takes 2 weeks of having chromium to kind of reset that. And the best thing to do in that time period, if you do get a sugar craving, is go for fruit first. So fiber is another thing that really helps your body balance blood sugar. It's how we digest the sugar properly. So if you're having fruit, you're satiating that sugar craving, and it's also helping you digest the sugar properly. And then if you've had fruit first, you've at least had some fiber to help you digest if you do decide you still need something after that. So it's a good sort of stopgap. But obviously, it is ideally, if you're trying to cut down the sugar, try not to eat too much during that time period as well. But
Yeah, yeah,
that
yeah.
tends to reset it, and I find that's a really good tip for January, because a lot of people they've been eating too much sugar, and then they're struggling to get a grips on it, especially because there's normally so much stuff lying around after Christmas as well.
Oh yeah.
So, and
And
that's
we get
another
into
good,
that panic mode, don't we, of needing to finish it all. We
absolutely,
got to
yeah,
finish it all.
that's another really good health tip. Remind yourself you are not a bin. It is not your job to clean these things up and put these unhealthy things in your body. You are not a bin. So that's
Yeah,
another good tip I would say for that time of year.
absolutely. I have a
And
feeling, I think chromium is in our metabolism support, which I must say I haven't bought in ages, but that might be a good one to get my hands on for January. So we don't do single mineral. We're not a supplement, a sort of mineral and vitamin supplement firm.
yeah,
They're usually a mix with a purpose. So I know that chromium is in our metabolism support
yeah, no, yeah, because
product. But
it
yeah,
helps with blood sugar basically, so that makes
mm,
sense. Yeah.
wonderful. And so tell me how people, just to wrap up, how can people interact with you? What have you got going on? Have you got any courses? What's your call to action? What would you like people to do?
Yeah, so I mean, so the new one is the Clear Mind Massage. So if you know anybody that's got headaches or migraines or anything like that, please
Mm.
do send them my way. But likewise, just and just yeah, spreading their word, because a lot of people are not aware that things like abdominal massage and this specialist massage like scars and things like that. I do a lot of fertility work and gynae work with the abdominal work. So there's a lot of things that there's not a lot of help for, that actually the specialist massage with the nutrition support can make a huge amount of difference. So yeah, if you know anybody with those issues, just tell them I exist. And I'm always happy
Perfect.
to help people, even if they feel like they can't come in for sessions for any reason. I'm always happy to have a chat with people, because I just wish that more people had more knowledge about all of these things. So there's
Mm.
not a lot of information out there. And if you Google some stuff, God help you, because it's then too much information and you don't know what's accurate and what isn't. So I'm always happy to have a chat with people if they're having health issues or things that I might be able to help with, to at least point them in the right direction, even if they can't come to sessions for any reason. So yeah.
Brilliant. Thank you so much. And what's your service area?
So I have a clinic in Oxfordshire and a clinic in Bedfordshire. And I quite often find people who travel a little bit around those areas see me. So it gives me quite a wide range,
Come to
which
see
is
you.
nice. I can also do mobile work, kind of up into like Cambridgeshire way and stuff like that. So yeah,
Yeah.
that kind of area. But do get in touch, because every so often I'm traveling around and could do the odd session. So even if someone's further afield, it's always nice of them to get in touch. Or sometimes I can recommend somebody that I know that's I don't know anyone that does all the stuff I do, but sometimes I can say, oh, that person might be able to help with this issue somewhere else. So yeah,
Brilliant.
always good to
Thank
get
you
in
so
touch.
much.
My
Well,
pleasure.
here's to a fantastically healthy 2025 then.
Excellent.
And thank you for coming on, Joe. And if you'd like to hear any more from Joe or get in touch with her, she'll be tagged on this, and I'll put her website and stuff on YouTube. And for me, you know where I am, so you can just get in touch if that sugar reset. We've got our 7-day fresh start or our 30 days to healthy living as well. So just pop us a note for that, so we can both help you. Thank you very much, Joe. And
My
I'll see you
pleasure.
soon. I'll see you at your Athena meeting in January.
Yes, look forward to it. Take care. Cheers.
Take care.
Bye.